All right, so today we're diving into something that I think is really important, and that's infected hip implants.
Oh, yeah.
And, the big question that comes up a lot is
Hmm.
single-stage revision versus two-stage revision.
Right.
Like, what do you do when you have a patient in front of you and you have to
Yeah.
figure out, okay, what's the best thing for this patient?
Yeah.
Not just for them, but, thinking about costs too, keeping healthcare costs reasonable.
Absolutely. And it's a decision I think every orthopedic surgeon really struggles with.
Right.
Do you go in and do everything at once, take out the infected implant, clean it all up, put in the new one all in one go,
Yeah.
or
Single stage.
single stage, exactly. Or are you going to go with that two-stage approach where you take the infected implant out, first put in a temporary spacer, maybe loaded with antibiotics,
Right.
and then bring the patient back weeks or months later to get that new hip implanted?
Yeah, for years that two-stage procedure was like the gold standard, right? Everyone thought that was the best way to do it.
Yep.
Give that infection time to clear up
Mm-hmm.
before you put in a new implant,
Right.
so you wouldn't risk it getting infected again. But I feel like there's got to be more to this.
Well, you are right on the money. There is more to it, and this is where things get really fascinating.
Okay.
There's this landmark study, the INFORM trial, and this study kind of throws a wrench in all that conventional wisdom.
All right.
It's the biggest randomized controlled trial we have that really directly compares single-stage versus two-stage revision when you have an infected hip replacement.
Wow.
They had over 140 adults in the study across 15 different centers in the UK and in Sweden.
Good.
And they randomly assigned each person to get either the single stage or the two-stage procedure.
Okay, so this is a big deal.
Huge deal. And what they found is really shaking things up in orthopedics.
Okay, I'm hooked.
It-
Tell me more. What did this informed trial find?
So the first big thing they found, and this is what really got people's attention, is that there was no difference in the long-term outcomes between the two groups.
Really?
When they followed up with these patients after 18 months,
Great.
both the people who had the single stage and the people who had the two stage, they all had pretty much the same levels of pain, stiffness, and function.
Wow.
And they measured all of that using the WOMAC score.
Okay, now remind me, what's the WOMAC score again for those of us who might need a little refresher?
Of course. So the WOMAC score, it's the standard way that we measure how well a hip is functioning.
Okay.
It looks at things like how much pain someone has, how stiff their hip is, and how well they can do everyday stuff, like
Right.
walking, going upstairs, even just putting on their shoes.
Yeah, those are important.
Totally. And the INFORM trial showed that after 18 months, both groups basically scored the same on that.
So all that extra time, effort, resources that go into that two-stage procedure,
Right.
it doesn't actually lead to better long-term results for patients.
Yeah, that's a really big deal.
That's a really big deal, especially when we're thinking about, what's best for the patient, but also making sure we're being smart about healthcare costs.
Absolutely. It's a game changer. For a long time, surgeons have always thought that two-stage approach was the best way to get rid of that infection and make sure the patient's going to do well in the long run.
Yeah.
But this data is showing that might not be true.
So if the long-term results are the same,
Hmm.
why not just do the single stage? It seems so much simpler, potentially less hassle for the patient, and maybe even easier on the healthcare budget.
You're right. There's definitely a lot to consider, but there is more to this story.
Okay.
And while the long-term results at 18 months were pretty similar, the INFORM trial also looked at how patients did during their recovery.
Great.
And that's where some really interesting differences started to pop up.
Right, right. Tell me about the recovery experience with each approach.
Sure.
What did they find?
Yeah, so
What were the differences?
the second big thing that came out of the INFORM trial, and this one's a big deal for how happy patients are with their treatment, is that the single-stage patients actually did a lot better on that WOMAC score 3 months after surgery.
Oh, that's interesting.
Yeah, and what that tells us is that they recovered faster and were able to get back to doing their normal stuff a lot sooner than the two-stage patients.
That makes sense. I
Yeah.
mean, if you think about it, one big surgery, and then you just focus on getting better versus going through surgery and recovery twice,
Right.
that's got to make a huge difference in how satisfied the patients are with the whole experience.
Absolutely. And think about it from the patient's perspective. If you have a single stage revision, you can start working on getting your movement back and doing things for yourself a lot sooner.
Right.
You're back to walking, gardening, maybe playing with your grandkids faster.
Yeah.
And all of that early progress can really help their mood and their overall well-being.
It's not just about how they heal physically, it's about their quality of life. And recovering faster definitely plays a big part in that.
For sure.
But what are complications? I'm curious about how safe each approach is.
Yeah.
I always thought the two-stage procedure, with all that focus on controlling the infection, was supposed to be safer.
Yeah, a lot of surgeons thought that too. But the INFORM trial actually showed something different.
Oh, really?
Their third big finding was that single-stage revisions actually had a lot fewer problems during surgery, especially fractures.
Hold on. Fewer complications with single stage.
Yeah.
But wouldn't having two separate surgeries give the surgeon more chances to keep an eye on things, fix any potential problems that come up,
Right.
and ultimately make sure there are fewer complications?
I know it seems counterintuitive, right?
Yeah.
But the thing is, having multiple surgeries actually increases the risk of complications, especially fractures.
Oh, I see.
Each time you operate, you're moving tissues, bones, implants around.
Right.
And even if you do it perfectly, that repeated movement can weaken the bone and make it more likely to break.
So you're trying to protect the bone from infection, but the way you do it sometimes makes it more fragile.
Exactly. And that's where really understanding the different types of spacers we use in two-stage revisions is super important.
Okay.
Some spacers are articulating, meaning they let the joint move a little bit. Okay. And others are non-articulating, which makes the joint more stable, but might limit how much the patient can move their hip. And the kind of spacer you choose can affect how much force is put on the bone and how likely it is to fracture.
So the type of spacer matters,
Yeah.
but you said that overall fractures were more common with the two-stage group. So why is that?
Well, it usually has to do with how much you have to move the bone around during that first stage of the two-stage procedure.
Okay.
When the surgeon takes out the infected implant and gets the area ready for the spacer,
Mm-hmm.
they might need to take out more bone to make sure they get rid of all the infection.
Right.
And that can weaken the bone and make it more likely to fracture, especially during the second stage when they take the spacer out and put in the new implant.
So it's like a catch-22.
Yeah.
They're trying to protect the bone from infection, but the process itself can sometimes make it weaker.
That's it.
This is fascinating, but it also makes me wonder about the long-term implications of all this. Could that higher risk of fracture affect how the patient does in the long run, beyond that 18-month mark?
That's a great question. The INFORM trial really just looked at how patients did up to 18 months.
Right.
It's possible that if we followed them for longer, we might see differences in things like how long the implant lasts, whether they need more revisions, or even if they develop arthritis because the fracture changed how the joint works.
Right.
We definitely need more research to figure all that out.
It sounds like we've only scratched the surface here, but let's talk about something that's probably on everyone's mind: cost.
Okay.
Doing two surgeries for the two-stage approach can't be cheap.
You're right. And that brings us to the fourth big thing that came out of the INFORM trial.
Okay.
When they looked at the costs, they focused on the patients in the UK. And what they found was that the single-stage revision was actually way less expensive.
Really?
And not just for the healthcare system, but for society as a whole.
So break it down for me. What are the big reasons why there's such a difference in cost?
Okay, so think about all the resources that go into the two-stage approach. You've got two separate surgeries,
Right.
which means double the time in the operating room, double the anesthesia, double the cost of the surgical team.
Yeah, that adds up.
Then you've got a longer hospital stay for each stage. They might need more rehab and ongoing care.
Right.
And then there are the indirect costs to the patients and their families.
What do you mean by indirect costs?
Those are all the costs that aren't direct medical expenses. Things like lost wages for the patient and their family.
Okay.
Maybe they need someone to help them at home, travel expenses for all the follow-up appointments, and just the emotional stress of going through two major surgeries and a long recovery.
That's like a domino effect.
Yeah.
All those indirect costs really add up and can impact the patient and their family in a big way.
Exactly. And the INFORM trial found that the single-stage approach, because people recover faster and don't need multiple surgeries or extended care, it actually significantly lowered those indirect costs too.
So it's not just about saving money for the healthcare system. It's about making sure the patients and their families aren't overwhelmed financially
Right.
and helping them get back to their lives and their jobs sooner.
Exactly. It's a win-win.
Yeah, it is.
Healthcare decisions have a ripple effect. They affect way more than just the patient.
Absolutely.
The INFORM trial really shows how important it is to think about those wider impacts on society when we're choosing between different treatments.
This is a lot to take in. And we've got this groundbreaking INFORM trial that's challenging everything we thought we knew about the best way to treat infected hip replacements.
It is.
And it sounds like the single-stage approach is coming out on top. You can help patients recover faster, it has fewer complications, and it saves a lot of money.
But
Right.
even though the data from this trial is really strong, we can't forget about the human side of things.
Of course.
Patient preferences should always be at the heart of how we make decisions. Research shows time and time again that patients care most about getting rid of their pain, getting back to their normal lives, and being able to move around the way they used to.
Every patient is different, Their
Yeah.
needs, their goals, their worries are all unique, and those things should guide our decisions.
Right.
But having this evidence from the informed trial is so valuable.
Yeah.
It gives us a solid base for those conversations with patients.
It allows us to have better discussions with our patients.
Yeah.
We can show them the data, explain the pros and cons of each approach, and really work together to choose the path that makes the most sense for them.
Shared decision-making at its best.
That's it.
And for our listeners out there, this is a reminder that you're not just someone who receives care. You have a say in this process.
You do.
Ask questions, understand your options, and work with your surgical team to make the choices that feel right for you.
Remember, the goal is to get the best possible outcome, both physically and emotionally,
Right.
while also being smart about how we use our healthcare resources.
It feels like we're at a turning point in how we think about infected hip replacements.
Yeah.
This informed trial has really shaken things up, given us a lot to think about.
It really shows how important it is to have good research, to challenge what we think we know, and ultimately provide better care for our patients.
Absolutely. But like any study, there are always going to be limitations in areas where we need more research.
Right.
You mentioned earlier that longer-term follow-up is so important.
Mm-hmm.
What other questions do you think this trial raises that we need to explore in the future?
Well, I think one of the biggest unanswered questions is the risk of reinfection in the long run.
Okay.
The INFORM trial followed patients for 18 months, which is good, but it's not really long enough to say for sure whether one approach is better at preventing reinfection over many years.
Right.
We need studies that track patients for like 5, 10, even 15 years to really get a clear picture.
That makes a lot of sense. I mean, infection control is a huge concern with any revision surgery. And while the two-stage approach has always been the go-to for minimizing that reinfection risk,
Yeah.
the INFORM trial suggests that maybe single stage is just as good, at least in the short term.
Exactly. And that's where those long-term studies are going to be so crucial.
Yeah.
They can help us figure out if there are any subtle differences in reinfection rates that show up over time, and if things like the type of spacer they used in the two-stage approach, the patient's overall health, or even the specific bacteria involved play a role.
It's complicated, so many factors to consider.
It is.
And while we're waiting for the results of those long-term studies, we still have to make decisions now based on what we know today.
Right. That's the reality of being a doctor.
Yeah.
We're always trying to incorporate new research findings, weigh the pros and cons, and most importantly, always put the needs of our patients first.
And that brings us right back to shared decision-making. We can share the data from the INFORM trial, explain the potential benefits and drawbacks of each approach, and really guide patients through the process of making the choice that feels right for them.
It's all about empowering patients to be involved in their own care.
Absolutely.
We can encourage them to ask questions, tell us what they're worried about and what's important to them, so we can work together to create a treatment plan that's tailored just for them.
This deep dive has been so eye-opening. It's definitely given me a lot to consider as we continue to learn and grow in the field of hip replacement revision surgery.
It's a good reminder that we should never stop learning, asking questions, and always looking for ways to improve the care we give.
Well said to our listeners out there. Thank you so much for joining us on this deep dive.
We hope.
We hope it's given you some valuable insights and sparked some interesting conversations.
Remember, knowledge is power.
It is.
The more we know, the better decisions we can make for our patients.
Until next time, keep those minds engaged and keep striving for excellence in everything you do.